Childhood cancer is a leading cause of deaths among children and adolescents. According to the World Health Organization, 400,000 children between 0 and 19 years are diagnosed of cancer every year. Data from the Ghana Health Service shows that cancer of the brain, kidney, eyes, liver, and tumors are the leading causes of death among children. As part of the National Health Insurance Authority's week celebration in the Upper East region on the theme, using the Ghana card for expanded health services, the authority announced a relief for children with cancers. Acting Upper East Regional Director of the NHIA, Kasimo Abdullahi, said the intervention by the authority to cater for some childhood cancers under the scheme is aimed at reducing mortalities.
Now we have roughly about 6 cancers covered, because originally we had breast and cervical cancer covered. Then now we are adding 4 childhood cancers. All other cancers for now are not included. So this is the first important highlight for this year. The second one is the inclusion of family planning benefits into the system. We piloted family planning in this region for 2 years, and research has shown that it is beneficial to put it in the benefits package.
Even though the childhood cancer intervention will save lives, the Upper East Regional Hospital unfortunately do not have the requisite equipment and specialists to take care of such patients. Pediatric ward doctor at the hospital, Dr. Gloria Abarike, says the government must resource the hospital with the needed equipment and personnel if the initiative is to succeed in the region.
This hospital, with regards to leukemia, we don't run peripheral blood from common. Even if we are going to run it, it's expensive. Patients have to run it from outside labs, and some of them cannot afford it. Apart from that, the solid tumors like kidney tumors, nephroblastomas, and all that, patients come all right. You can make a diagnosis with an ultrasound. It will give you an idea of what is going on, but you need a CT scan and probably a biopsy further to confirm this diagnosis. We don't have a CT scan in this hospital. So if it's added to health, it will help us all right, but we need the capacity also to be able to make the diagnosis. Aside that, we need an oncologist who will be able to carry out with this, make these diagnoses correctly and treat them correctly and follow up to make sure that these cancers are cured.
Touching on the NHIA indebtedness to service providers, Mr. Abdullahi assured that healthcare providers under the NHIS should exercise patience as efforts are underway to clear all arrears owed them.
Some years back, we owed providers about 14 months of claims. But as we talk, we've paid most of them to around March, April 2021. Given the cyclical adjudication process of 3 months, usually it takes not less than 3 months to process claims when submitted. It means that if we've paid up to around March, April, we are now in November, we are left with just about 6 or 7 months. If you take away the 3 months of cyclical process, we are roughly left about 3 to 4 months of indebtedness. And that's a massive improvement from 14 months to 4 months. That's massive improvement. And all efforts are on course to clear these bills. Hopefully by next quarter of 2022, all the bills should come to zero so that we shall live hand on hand. You submit your claim, we'll vet you and pay you on time.
Mr. Abdullahi reiterated that the scheme has chalked successes in its enrollment of subscribers, but not without challenges. Thus, his appeal for support. As a national health insurance scheme in the Upper East region takes steps to achieve universal health coverage by 2027, children with critical cancers such as cancer of the kidney, the blood, the eye, and the jaw and abdomen will no longer have to pay huge sums of money to undergo treatment, as the scheme will take full responsibility of their diagnosis and treatment. Reporting for City News, I'm Frederick Aouni, Bolgatanga.